Hey guys, welcome back to the channel. So your dog is itchy and your vet gives you a magic little white pill that makes all the itch go away. And your dog looks great and happy and healthy. And this drug probably is called Apoquel. And what is Apoquel or oclacitinib? Does Apoquel actually cause cancer? What are Apoquel's common side effects? And how does it really work? So those questions are what we're going to answer in today's video. And hopefully I can do this in everyday language that you guys can understand and appreciate. So let's get started. What is oclacitinib or Apoquel? I'm going to call it Apoquel because oclacitinib is hard to say. The drug looks a little bit like this, and you should see it on your screen right now. And basically it's a drug that is supposed to stop itching. So why does itch occur? We're going to talk a little bit through that pathway. So what about Apoquel and how does it work? There's a pathway of cytokines where cytokines are a signaling molecule that are produced by cells for cell-to-cell communication, usually within a local area, but sometimes they can be diffusely throughout the body. And these cytokines or signaling molecules are going to try to transform the cells around them to be prepared to deal with an existential threat. And that's how the body was designed to do that. The body does this in order to fight off invaders such as parasites, bacteria, viruses, and others. And unfortunately, during the allergy pathway, it also uses these cytokines to try to fight off the invaders such as pollen or other large proteins that really are not a threat to the body. And these cytokines are going to go through a pathway, and one of the receptors in that pathway, and one that is kind of a bottleneck where there's not a way around it, is called a Janus kinase enzyme. And essentially, we're just going to call it the JAK receptor. We don't need to understand exactly how it works today, but it responds to these cytokines such as IL-6, IL-2, IL-4, and a few other ones as well. And these signaling molecules, and you don't need to remember the specifics, just remember that they're signaling molecules, are going to set off a cascade starting at the JAK receptor. In response to the JAK receptor being activated by these cytokines, we're going to see a pathway within the cell that eventually is going to lead to a transformation of the cell by changing what proteins are being produced inside, by using a whole bunch of intracellular signaling molecules. So what we're trying to do with Apoquel and what it's designed to do is bind the JAK receptor so that it can't be set off, so that it can't be activated by one of these cytokines. And being that it's such a specific pathway where, although JAK receptors, as we'll see in a little while, probably have some other things, they're a very, very narrow spectrum of what they do. By blocking the JAK receptor, we're being able to prevent this transformation of the cell into basically a cell that's ready to go to war. And by doing so, we're decreasing the amount of inflammation. Apoquel's goal was to have as much itch control as something like prednisone or another steroid, which are very effective at stopping itch. But unfortunately, they have a lot of side effects, such as panting, hunger, thirst, excessive urination, and Apoquel is so much more specific to and Apoquel's target molecule, the JAK receptor, is much more of a specific target than that of a steroid, which affects a lot of different parts of the body. Cancer and Apoquel, there have been a lot of things on the internet and going around on social media, etc., that says you should never use Apoquel in your pet because it causes cancer, and that's false. But the reason that has been going around is that there's a statement on the Apoquel drug label that says Apoquel may increase the susceptibility to infection, including demodicosis, and exacerbate neoplastic conditions. And there have been dogs that have been found to have masses or cancer soon after beginning administration of Apoquel. Apoquel works by stopping a signaling chain that stimulates itch. But like any drug, this signaling pathway is more than just for causing itch or only in allergies. It probably does play a role in the control of neoplastic conditions and possibly parasitic infections such as Demodex. Apoquel is not mutagenic, meaning that it does not cause changes to the DNA or does not cause mutations, and so it's not going to cause cancer. What may happen, because it's been loosely associated with different types of cancer, basically we think it could be causing the cancer to manifest itself more quickly. Most likely, these pets are already having cancer somewhere in their body. It just hasn't shown itself. And because Apoquel is affecting those cytokines that potentially have the chance of fighting cancer, they probably still will be a losing battle even if the Apoquel wasn't there. It just sometimes may increase the speed at which the cancer starts attacking and how long you have to treat it. What are the common side effects of Apoquel? The most common side effects that we see with Apoquel are vomiting and diarrhea, and usually these will be gone with continued use. So do I recommend Apoquel? Well, yes and no. There are a lot of cases where I will recommend this to my patients. However, I'm not recommending it for you guys without talking to your veterinarian first. What I am trying to do in this video really is to explain how it works and talk about the side effects and talk about the maybe misconceptions or maybe valid point depending on how you look at it. Apoquel is not for everybody. There are a lot of cases where I'll use it for short-term treatment. So if I have an ear infection and want to take the inflammation out and do a 2 or 3 week course, and eventually try to make my patients more comfortable through a shorter course. Some of my patients will use Apoquel for several months or all year round, and I'll recommend using it often with a food trial. So for 6 weeks, do Apoquel and a food trial with a specific hypoallergenic food or a novel protein source. And with this, then I will recommend using Apoquel and cutting the Apoquel off basically to test. Is this a food allergy or is this an environmental allergy? I won't use it on dogs that are under a year of age or if they have neoplastic conditions. And I'm even hesitant to use it in some of my older patients that have a higher risk of having neoplasia. One of the other things that sometimes I've run into is that some of my patients will just not respond to it like they used to. It worked really well for 2 or 3 months and then it really started to fade away and no longer was as useful. So I don't recommend this for all my patients, and I have specific use cases where I find it most valuable. And I will say that its claim for 4-hour itch control can sometimes be very true. I use this in my dog as needed, so I don't use it every single day, but he does have some environmental allergies where during the summer, like these months, he's super itchy and it just can help to take away the itch and help me sleep, help my wife sleep, and help him sleep most importantly. This drug isn't a cure-all, it's not a magic pill, but it is a very good drug that when used correctly is very, very good, and usually the side effects are pretty known. So this isn't a specific recommendation to use Apoquel. Let's be clear about that. Thank you guys so much for watching this video. Hopefully you enjoyed it. The next video is going to be about Cytopoint, which is another drug that works on the same pathway, but in a very, very different way with very different side effects. So if you guys are interested in learning about Cytopoint, make sure you watch the next video, which will either be on a Tuesday or a Friday. I try to post every single Tuesday and Friday, so hopefully you guys enjoy it, and we will see you in the next one.